Your module 8 of CRI 089. So, atong topic is about sprain and strain and the symptoms of sprain and strain. So, the term sports injury is the broadest sense, refers to the kind of injury that most commonly occur during sports or exercise. Some sport injuries result from accidents, others are due to poor training practices, improper equipment, lack of conditioning, or insufficient warm-ups and stretching. Sprain and strain are among the common musculoskeletal injuries that occur. So, ang tawag sa mga gakahitabo nga injury sa mga games is sports injury. So, what is sprain? Lainan sa sprain o strain, ang sa sprain, inyong timan-an, ang S o ang L. Sprain for a tear of ligament. Kung strain, ang S o ang T. T for tendon. So, mora na, para di mo malibog sa iyang definition. Sa strain na ay T, tendon. Sa sprain, L, ligament. So, for definition of sprain, a stretch or tear of ligament, the band of connective tissue that joins the end of the bone with another. So, ang cause ani is trauma, fall, or blow to the body that knocks a joint out of the position. So, makilo ka, kani ang sprain. So, varying degree of pain, bruising, inflammation, swelling, inability to move limb or joint, and instability of the joint ang symptom. So, ang strain is a twist or pull of or tear of muscles or tendon. So, lagi ni tendon or strain. Basta na T, tendon. So, overstretching ang cause or overcontraction of muscle. Ang sign and symptoms include pain, muscle spasm, loss of strength, bruising, may delay for several days. Kaning gapanggahi inyuhang bagtak mo ni siya ang strain or ang inyong sa muscles or sa inyong tendon. So, ways to prevent sprains and strain. So, i-maintain inyong healthy nga weight. Avoid fall asleep by keeping walkways in and around your home clear for clutter. And wearing protective equipment sa pagdula. So, mag-protective equipment daw ka. So, this is the riser. Mo ni siya inyong timan-an kay magawas na siya sa inyong exam. Riser is a first aid technique used in the first 48 hours or 2 days after the sprain or strain or fracture. It can limit swelling and help speed up recovery. Pero matambalan inyong sprain, strain, and fracture, riser inyong buhaton. So, what riser stands for? Riser is rest. Do not move the injured body part. Mag-rest ka. Ice, apply ice pack. Ice pack ka to reduce swelling. Next, compression. Wrap a bandage around affected joint. So, compression. Elevation, raise the injured joint above the rest of the body to reduce swelling para dili mo hubag. Seek professional medical care as necessary. So, riser. Rest, ice, compression, elevation, and refer. Timan igayod ka na ni. Next is ang kalainan daw. Dayon, if you have a sprain, it means that you have injured ligament. So, ligament daw ang sprain. Sakto ba? Sakto. In strain, a muscle tendon is involved. ST, T for tendon, so true. The most common site for a sprain is the wrist. False daw. Dili daw ang wrist. The back is common site for strain. True daw. Ang imo daw likod. A muscle spasm can be symptom of strain. Manggahi imong muscle. It's true. Next is, a sprain is an injury to ligament. So, ligament na siyang sprain, ha? What is riser treatment? Rest, ice compression, elevation, and refer. So, which following are symptoms of sprain? Select all that apply. So, muna siyang symptom. Pain, bruising, swelling, loss of normal function, and inflammation. Which of the following risk factor contribute to injury? So, ang dili ra apilani is ang proper posture. So, ang risk factors is using excessive force, poor physical condition, dili ga warm up before ang activity o repetitive movement. So, balik-balik ang movement. What can you do to prevent strain and sprain? So, ang inyong buhaton, use proper posture. Eat right and get plenty of exercise. Use the right tools and equipment and stretch. Kaning bent at the waist when picking up object, dili daw ni siya maayo nga mag-prevent og sprain og strain. So, which of the following is possible symptom of both strains and sprains? So, kanitanan mo ni sila ang mga symptoms sa sprain og strains. Next, your friend has a strain or sprain and you apply something cold to the injury. How does this help? Oh, so again, no. For if look for if you think someone has strain or sprain, bring all of these so tanan. You're helping someone who has strain. Where should you place ice pack or ice both frozen? So, dito daw sa indirect to the injury. Your type of burn, thermal burn, cold what? So, knowing the most common causes of household fire, except planning, encourage regular home fire exit drill. Dili sad mo for me regular home fire exit drill ha. Dili is sunburn. Kayo pa ka result sa full thickness burn, ang sunburn. Dito ra na siya sa first degree burn, ang sunburn. Kaning scald injury, chemical burn, electrical injury. Dito na ni siya sa full thickness burn or third degree burn. So when assessing a patient with partial thickness burn, a nurse would expect to find SATA. So muna ni SATA. Blister, intact nerve ending, red, shiny, wet. So although choking is common in infants and children, more adults than children die each year as a result. So mas daghan tigulang kaysa sa bata ang gakamatay sa choking or gakatukan. So which statement regarding impaled object is correct? In all cases, impaled object should not be removed. So dapat kato daw mga object dili daw siya i-remove. So what the common type of wound is scrape. It can easily become infected if not clean. So ang scrape daw dito ra ni siya infected kung dili ninyo siya i-heal dito. So if someone is choking and they are coughing effectively, let them cough, but you may need to reposition them to help. So inyo siyang ipaubo kung naay natukan. So if a baby is choking and unable to cough, check if there is an obvious obstruction without fingers sweeping, and then turn over onto your arm supporting their head and should be lower than their stomach and hit them firmly between their shoulder blades. So dito kan naay bata nga natukan, inyong i-check kung naay nakuan siyang baba ug ayaw ninyo kusga og hapak ang likod ug mura siya inyong inclined position or ipabalilit ang bata pero ayaw sa nang balin na gid kay nga murag inyo lang gi kuan nga dull dili na pero medyo lang dili lower lang sa iyang stomach ang iyang head para iyang maluha. And someone is clutching their throat and unable to cough or speak, what should you do? So check if there is nothing obvious in their mouth, lean them forward and give up 2-5 back blows. So inyong i-blow ang iyang back. So someone is choking, you have 5 black blows that haven't worked. What should you do now? Give 5 abdominal thrust. So kani siya inyo na siya. Kana bitong inyong ibutang ang inyong kamot sa ilang kuto-kuto dapit mo nakabuok para musaka tungkong na in case na ay blockage sa iyahang airway passage. So someone is choking, you have repeatedly 5 back blows followed by 5 abdominal thrusts, more back blows. You have called an ambulance, but they suddenly go fluffy, lifeless, and unresponsive. What should you do next? So inyong buhaton, check if they are breathing. and if not, place them on a flat surface and start CPR. Kung wa na gid sila naginhawa after you did your part, then inyo na gid na silang ipahigda and start na mo CPR. A person is choking before you can start treatment, they collapse to the floor. What should you do first? Open the airway and check for normal breathing. So, mo na yung button. Tanawan gid ninyo unay lang ba kung naabi naka-block o sakto ba ilang paghinawa. So, when performing an adult abdominal thrust, where should you place your fist? So, above the belly button. So, ibabaw. There is inyong kuto-kuto ha. Above sa inyong belly button. So, what causes choking? A foreign object becomes stuck in airway, preventing air reaching the lungs. If you successfully dislodge an object using abdominal thrust, the patient doesn't need to seek medical attention, so it's false. Kinahanglan gyapon mo magtawag og medical attention. You can perform abdominal thrust on a baby. It's false. Dili mo dapat magkuan og abdominal sa baby. Abdominal thrust sa baby. So what is treatment for mild airway obstruction? So inyong mild ra dili kay siya kuan ipauburan ninyo ng tao. So, next is, what are the common symptoms of ankle sprains? Recollection of accidents when you twisted or landed awkwardly on an ankle. Subsequently, pain, swelling, and bruising over the injury site. Difficulty in weight bearing and restriction to the movement of ankle joints. So, muna siya ang inyong symptoms sa ankle, sa sprain sa inyong ankle. Dili sa inyong ankle ha, nga inyong mga ankle, di na sa inyong balay. So, that's all for this. Great job everyone sa inyong module 8. Thanks!